Welcome to what we like to call the retirement plot twist that nobody puts on their vision board. You have dreamed about sleeping in, sipping coffee at noon, and finally telling your alarm clock who is boss. But somewhere between the freedom fantasy and the actual retirement party, a very expensive reality shows up uninvited, and its name is healthcare. Here is the brutal truth that the glossy retirement brochures conveniently leave out. If you retire before age 65, you are essentially jumping out of the employer insurance airplane before the Medicare parachute is anywhere near ready to open. And yes, you will need to build your own parachute on the way down. Sounds stressful. It absolutely can be. But here is the good news. Thousands of early retirees have cracked this code, and once you understand your options, this so-called coverage gap transforms from a financial nightmare into a very manageable planning challenge. So whether you are 5 years away from your early retirement date, or you're already living the dream and quietly panicking about your insurance situation, you are in exactly the right place. Stick around, because what comes next could genuinely save you tens of thousands of dollars and a whole lot of unnecessary heartburn. And we mean that both literally and figuratively. Here is the thing nobody tells you at your retirement party while you are cutting the cake and dreaming about sleeping in on Mondays. One surprise medical bill without proper coverage can absolutely obliterate the nest egg you spent decades building. We are talking about the kind of financial gut punch that turns your early retirement fantasy into a very expensive nightmare. But here is the good news, and this is where it gets genuinely exciting. The Affordable Care Act, also known as the ACA, has essentially become the secret weapon that millions of early retirees are using to bridge that coverage gap without going completely broke in the process. So if you have ever Googled something like, "How do I get health insurance before Medicare?" or "early retirement health coverage options," congratulations, you have found exactly the right place. Because today we are breaking down everything you need to know about navigating those ACA gap years like an absolute professional, saving serious money along the way, and actually enjoying the early retirement you worked so incredibly hard to earn. Now that we understand what the Affordable Care Act gap years are, let's talk about why this period carries such serious financial risk. For individuals in their 50s and early 60s, healthcare costs are already climbing significantly. Studies show that a 60-year-old can pay anywhere from $500 to over $1,000 monthly for individual coverage without employer support or subsidies. But the real danger goes beyond monthly premiums. A single unexpected medical emergency, whether it is a heart attack, a cancer diagnosis, or a major surgery, can generate bills ranging from tens of thousands to hundreds of thousands of dollars. Without proper coverage, those costs come directly from your retirement savings. Years of disciplined saving can be wiped out in a matter of months. Being uninsured or underinsured during this window is not just inconvenient, it is genuinely devastating to long-term financial security. Picture this. You've spent decades meticulously planning your dream retirement, crunching numbers, maxing out your 401k, and finally, gloriously, you hand in that resignation letter, only to discover that your carefully crafted financial masterpiece has one catastrophic missing piece: health insurance. Yes, that's right. The same coverage you barely thought about when your employer was quietly handling it is now front and center, ready to drain your retirement savings faster than a leaky faucet in a mansion. We are talking about the coverage gap, that sneaky, expensive, and frankly rude period between the day you retire and the magical age of 65, when Medicare finally rolls out the welcome mat. So buckle up, because in this discussion we are going to expose every option available to bridge this gap, from the surprisingly useful Consolidated Omnibus Budget Reconciliation Act continuation coverage to the Affordable Care Act marketplace subsidies that could actually work in your favor, and everything in between. Because the only thing worse than retiring early is retiring early and going broke, paying for a doctor's visit. Now, before we dive into the nitty-gritty of COBRA coverage, let me ask you something. Have you ever opened a bill and felt your soul briefly leave your body? Because that is essentially the COBRA experience in a nutshell. COBRA, which stands for the Consolidated Omnibus Budget Reconciliation Act, yes, someone really named it that, allows you to keep the exact same employer-sponsored health insurance plan you had while working for up to 18 months after leaving your job. No switching doctors, no scrambling to find a new network, no benefits disruption. Sounds like a dream, right? Well, here comes the plot twist that nobody asked for. While you were happily employed, your employer was quietly covering a big chunk of your monthly premium behind the scenes, like a financial guardian angel you never knew you had. Under COBRA, that angel clocks out, and suddenly you are footing the entire bill yourself. Employer contribution, your contribution, plus an administrative fee of up to 2%, all landing squarely on your shoulders. The result? Your monthly healthcare costs can skyrocket from a few $100s to well over $1,000 per month. So yes, COBRA keeps everything familiar. It just does so at a price that might make you want to go back to work immediately. Now that we have covered COBRA, let us explore what is often a more affordable and flexible solution for gap year coverage, the Affordable Care Act marketplace plans. These plans are available through healthcare.gov or your state's own exchange, and they offer structured coverage across 4 metal tiers. Bronze plans carry the lowest monthly premiums but the highest out-of-pocket costs. Silver plans sit in the middle and are especially important for subsidy purposes. Gold plans offer lower deductibles with higher premiums, while platinum plans provide the most comprehensive coverage at the highest cost. You can shop for these plans during the annual open enrollment period, which typically runs from November through January. However, if you recently lost job-based coverage, you qualify for a special enrollment period, giving you 60 days to select a new plan. Now here is where things get really powerful for early retirees. The Affordable Care Act offers 2 major financial tools: premium tax credits and cost-sharing reductions. Both are based on your modified adjusted gross income relative to the federal poverty level. If your income falls between 100 and 400% of the federal poverty level, you may qualify for significant premium subsidies. For a single person in 2024, that range is roughly $14,000 to $58,000 annually. The lower your income, the larger your subsidy. Cost-sharing reductions, available on silver tier plans, can also dramatically lower your deductibles and out-of-pocket costs. Here is the key insight. In retirement, you have more control over your taxable income than you think. By carefully managing withdrawals from different account types, early retirees can strategically position their income to maximize these subsidies and potentially pay very little for comprehensive health coverage. Building on what we just covered about subsidies, let's talk about how you can actively manage your income to stay within those subsidy-eligible ranges. This is where tools like Roth individual retirement account conversions become incredibly powerful. During your gap years, if your income is lower, you can convert portions of your traditional individual retirement account into a Roth individual retirement account at a lower tax rate, while carefully controlling how much taxable income you generate. Similarly, Capital gains harvesting allows you to realize investment gains at reduced or even zero tax rates depending on your income bracket. Strategic withdrawal sequencing, meaning choosing which accounts to pull from and when, also plays a major role. Done correctly, these techniques can keep your modified adjusted gross income right within the subsidy sweet spot, potentially saving you tens of thousands of dollars in healthcare premiums across your gap years. Another option worth investigating before you retire is retiree health benefits offered directly by your former employer. While this benefit has become increasingly rare over the decades, certain large corporations, federal and state government agencies, and labor unions still provide some form of retiree health coverage. If you spent a significant portion of your career with one organization, it is absolutely worth contacting your human resources department to ask whether retiree health benefits exist and what the eligibility requirements are. These plans typically require a minimum number of years of service and a minimum retirement age. Coverage can range from comprehensive medical plans to supplemental coverage that works alongside Medicare. Do not assume this benefit is unavailable simply because it is uncommon. Discovering this option early could save you thousands of dollars annually during your gap years. Beyond traditional insurance, some early retirees explore health-sharing ministries as a cost-saving alternative. These are faith-based organizations where members pool money together to cover each other's medical expenses. Monthly contributions are often lower than standard insurance premiums, which makes them appealing at first glance. However, the limitations are significant. Health-sharing ministries are not regulated like insurance, meaning they can deny claims, exclude pre-existing conditions, and are not legally required to pay your bills. There is no guarantee of coverage, and gaps in protection can be financially devastating. Short-term health plans are another alternative sometimes considered during the gap years. While they offer lower premiums, they typically exclude pre-existing conditions, mental health care, and prescription drugs. Both options should be approached with serious caution and only considered after fully understanding their considerable risks and restrictions. For early retirees with lower income levels, Medicaid can serve as a powerful and often overlooked bridge option during the gap years before Medicare eligibility. Medicaid is a government-funded program designed to provide health coverage to individuals who fall below certain income thresholds. Generally, eligibility is based on your modified adjusted gross income relative to the federal poverty level. Thanks to the Affordable Care Act expansion, many states have raised income limits, allowing single adults earning up to approximately 138% of the federal poverty level to qualify. This has made Medicaid significantly more accessible than it once was. However, it is critically important to understand that Medicaid rules vary widely from state to state. Some states have not adopted the expansion, meaning eligibility requirements remain much stricter. Benefits, covered services, and provider networks also differ considerably depending on where you live. Now that we have covered your coverage options, let us talk about the practical side of planning, specifically how to actually budget for healthcare during your gap years. Start with premiums. Depending on your age, location, and income, monthly premiums can range from a few $100s to well over $1,000 per person. Next, factor in your deductible, which is the amount you pay out of pocket before insurance kicks in. Then consider your out-of-pocket maximum, the absolute ceiling on what you could spend in a single year. A smart approach is to build a dedicated healthcare reserve fund, separate from your general retirement savings. Aim to set aside enough to cover at least 2 to 3 years of worst-case healthcare expenses, This buffer protects your broader retirement portfolio from unexpected medical costs. Another smart strategy worth considering is working part-time or taking on a consulting role specifically to gain access to employer-sponsored health benefits. This approach lets you stay semi-retired while solving the coverage gap problem at the same time. Several well-known companies offer health benefits to part-time employees, including Starbucks, Costco, United Parcel Service, and REI. These employers extend benefits to workers who meet minimum hour thresholds, often as low as 20 hours per week. This means you could work just a couple of days weekly and still secure meaningful health coverage. Beyond the insurance benefit, part-time work also supplements your retirement income, reducing how much you need to withdraw from savings. This preserves your portfolio and may even help you manage taxable income to stay within favorable subsidy ranges on the Affordable Care Act marketplace simultaneously. As you approach age 65, coordinating the shift from gap year coverage to Medicare becomes essential. Medicare's initial enrollment period spans 7 months, beginning 3 months before your 65th birthday, including your birth month, and extending 3 months after. Missing this window can trigger permanent late enrollment penalties, increasing your Part B premiums for life. To avoid gaps, plan to enroll in Medicare Parts A and B before your current coverage ends. If you have an Affordable Care Act marketplace plan, notify the marketplace once Medicare begins, since keeping both creates compliance issues and you lose subsidy eligibility. Align your ACA plan's termination date with your Medicare start date to ensure seamless coverage. Starting this coordination process at least 6 months before turning 65 gives you adequate time to avoid costly mistakes. We have covered a tremendous amount of ground today, and the central message is clear. The gap years between early retirement and Medicare eligibility at age 65 represent one of the most significant financial risks in any retirement plan. From COBRA and Affordable Care Act marketplace plans to Medicaid, retiree benefits, and part-time work strategies, you have real options available. The key is starting early. Do not wait until your last day of work to figure this out. Begin mapping your healthcare bridge strategy at least 3 to 5 years before your target retirement date. Work with a financial advisor who genuinely understands healthcare cost planning and income management. Your gap years should be years of freedom, not financial anxiety. Take action today, plan strategically, and protect the retirement you have worked so hard to build.